Welcome back. Tonight, we're taking a look into why there's a shortage of people in a critical line of work, one many of us might need to save our lives.
They're certainly very important positions. Our Caitlin Sinnett went with paramedics to see what can be done about it.
I'm going to call the ER, let them know we're coming.
Fewer EMS providers like Blair Brzezinski in Arkansas are out saving lives.
We're currently en route to your facility with a 59-year-old male coming from home. The chief complaint is shortness of breath and chest pain, onset starting last night.
The Arkansas Department of Health reports almost 800 EMTs and paramedics did not renew their licenses this year, which is about 10% of total providers in the state. At Baxter Regional Medical Center, there are 57 full-time EMTs and paramedics. But this summer, they had 7 openings at one point. Mercy Hospital reports 17 openings across their service area, which includes Southwest Missouri and part of Arkansas. One of the major reasons why there's a paramedic shortage is many of them are transitioning to nursing, and that's for a number of reasons. Zach Reed at Baxter Regional is one of the employees who made a switch.
Financially, you make a lot more money to provide a lot of the same interventions that you do in the ambulance.
A registered nurse's starting salary at Baxter Regional is $21.50 an hour. A paramedic is about $6 an hour less. There's also other benefits, like better schedules and more opportunity for advancement.
We have 3 paramedics in the last 6 months that have transitioned into nursing. And I think providers all over the state of Arkansas are experiencing that same trend.
That leaves depleted ranks in our normal EMS.
And when there aren't enough, the ones who are working overtime.
It's harder to staff ambulances appropriately would be the key word. The medics that you do have are running so many calls and are doing so many other things that they get burned out. They just get tired of doing it.
Which could affect you at home if you ever need them.
It's a possibility that they won't have the level of care that they want.
Here in Baxter County, they do what they can.
So if all of you are out,
We have to do what we have to do.
okay.
We have quick turnarounds. We have enough trucks.
And if an ambulance can't get there right away, the fire department does what it can until paramedics arrive. During our ride along, the supervisors who weren't supposed to be on call even pitched in.
Sometimes if we're real backed up, Gerald and Chris will jump in a unit and go on a run.
Make it work.
We have to make it work. We have a limited amount of ambulances, and that's what it goes by. But we're pretty darn good about our run times.
Even though some paramedics are switching to nursing, Lacey Quine is doing the opposite. She says the shortage of emergency responders is concerning.
Car wrecks, fires where people are injured, you're the first person there. And when you don't have enough staff, you don't have enough trucks to serve your area. When that happens, you have communities that don't have what they need to take care of people when they're sick.
Some hospitals like Baxter Regional are trying to offer incentives to recruit and keep paramedics, like a signing bonus. Despite the shortage, paramedics say the work fulfills them.
There is nothing more humbling or rewarding than knowing somebody is calling you in their darkest hour and you have the opportunity to help them, to fix what's broken, to make them feel better.
Reporting in Baxter County, I'm Caitlin Sinnett.